Well, let's talk now to Dr. Sally-Ann Wilson, who is the chair of the Royal College of Emergency Medicine's Safer Care Committee. Morning to you. So can you just explain to us what are the concerns and why there should maybe be a change in the advice on these slushies?
The concerns are that the blood sugar can drop quite quickly and quite dramatically in young children, and that can present in milder cases. It can just be a bit of headache and the sort of thing that children get very commonly, sort of feeling a little bit sick, a little bit of tummy pain, just not feeling their normal selves. But in more extreme cases, that they lose consciousness, drop into a coma, sometimes can fit, and their blood sugars have dropped quite dramatically, and that's when they need urgent hospital treatment.
So it sounds potentially like at the milder end of the scale, this is the sort of thing that might happen to children more regularly and parents might not know what to look for.
Exactly, yes. I think it's been under-recognised, including by people in the emergency department, until the FSA put out the information about it. Our awareness probably wasn't good either. But people knowing what the symptoms are is important, I think.
And how many doctors do you think are aware of this? And if a child presented with a problem, for example, in accident and emergency, would it be something that was the first thing they would think about?
It probably isn't the first thing that we'd think about, because there are a lot of other things to look at if you've got a child that's got a low blood sugar, that might be a different cause. But certainly the awareness we tried to raise from the Royal College last year, when we become aware of new or emerging problems or under-recognised problems, we issue something called a safety flash, and that is sent to every department in the country so that it helps raise awareness within those teams. It doesn't mean that every single doctor will have read it, but certainly the information is now available to them in a format from the Royal College.
Do you think it would be helpful for parents to increase the minimum age for these to 8, or does it need to be perhaps even higher?
All the things that we think about from a dosing of medicines, we base on weight, and it's really difficult. So the guidance that we put out was around 16 kilograms and below. One slushy could make them quite a child though that weight quite unwell. But it's difficult from a seller's point of view to know the weight of the person that is about to consume the slushy. I think it's all about the information given to parents. As a parent, you want to make sensible decisions for what you buy your child. And if you're not aware that there is the glycerol in the slushy and what that can do, then you're not going to have any qualms about buying said slushy. So I think a lot about information. Age-based, it's difficult because there's a variation in weight. Erring on the side of caution and increasing the age would indeed cover all of those lower weight children. So there's definitely an argument for that.
Dr. Sally-Ann Wilson, thanks so much for talking to us this morning.